Sir, we are live now.
Good morning, all. Warm welcome to For the Students, by the Students webinar series. And I welcome our ExRx team members, Dr. Rupesh and Professor Duna. And in association with Fecal Studio, Sri Samraj Health Services Private Limited, and DUSAT Creations from West Bengal. Today's fourth topic is delayed onset of muscle soreness. Will be presented by Ms. Awina from Father Muller Medical College. Now I request Awina to start the session, please.
Hello, good morning, everyone. I'll first introduce myself. I am Ms. Awina, and I am from Father Muller Medical College. I'm doing my post-graduation. And the topic that I'll be covering today is delayed onset of muscle soreness. Now, delayed onset of muscle soreness is nothing but it's also called as muscle fever. Okay, so it's just a time wherein your muscle gets a little burn and it gets that warm sensation. Okay, so let's dive into this topic and I will tell you a brief detail and I'll give you a brief overview of what exactly happens in this, what are the theories behind it, and some physiotherapy management, as well as whatever in the we have done till recent in this area and what we can actually still do about. So let's just get into it. Okay, so these are the topics. This is the thing that I'll be covering in my slide. So there'll be the definition. What is this? There'll be a difference between cramp or spasm and DOM. So as we know that they are very closely linked to each other. So an important differentiation should be made by them. Then the location of the soreness. So as we know, it's important for us to know the location of soreness because accordingly we can be able to give a proper treatment. Accordingly, we'll be able to give a proper modality treatment in that region. Okay. Then the factors that can actually cause it, the different theories and thought processes, the school of thoughts behind muscle soreness. Then the sequence of like how the delayed muscle soreness actually happens in a proper stepwise manner. The biochemical markers involved in it. So as your muscle tears, there's going to be a lot of markers, going to be a lot of enzymes which is given out in the bloodstream. So that's all going to be there in your bloodstream. Then the effect of DOMS on strength. Factors for reducing delay onset of muscle soreness. So how would you actually take and what are the preventive measures that you would actually take to reduce these soreness and the further occurrence of it, the line of management for it and recent advances. Okay, so delayed onset of muscle soreness or called DOMS or called muscle fever is a temporary condition. Okay, it's not a permanent, it's a temporary condition which happens because of unaccustomed activity. So this is something which I would like to highlight upon. It's an unaccustomed activity which happens because of an eccentric muscle action. So whenever a muscle action which is like eccentric contraction, which is a main culprit for this kind of injury to occur in your muscles. Okay, so they say that whenever you do any activity, like after you have got DOMS, any amount of activity by just moving your limb or something, or if you just apply pressure at the muscle, you're definitely gonna get pain. So that's how you would identify, oh, you have got something like this, you've got some sort of muscle injury. Okay, active contraction, passive stretching, manual palpation, so touching or movement or anything is gonna cause you pain. Okay, so this is just a representation showing like how exactly like the entire time frame of how DOMS actually occur. So on day one, wherein you have the workout. So you go to the gym, you are like, oh yes, I'm gonna do the workout. So you'll be like fully, you will do a high intensity physical activity. You want to lose weight or you want to do something like that. So it was on those lines. The next day is called the calm or the storm. So on that time, you are setting the pace for pain. So it will be going on slowly, but you will be not experiencing it in in that level. Okay, so that would be around 24 hours of from the workout or from the exercise, from the strenuous exercise, which is eccentric training especially. And the third day, which is nothing but at 72 or 72nd hour, wherein the pain is tremendous. It's extreme. Okay, so it goes in a peak fashion. So whenever we have delayed onset of muscle soreness is basically on a period of 1 to 7 days, with the first day of the exercise to the uh, seventh day, you will have the experience of this pain, or you'll have some sort of discomfort, but it will be peaked on the 72nd day of your workout. So that is the moment that you will have the peak. Okay, it wouldn't be sudden. And yeah, so I would just like to give you a small clear classification in this moment. Like whenever you do an exercise, like for example, if I go for doing an abdominal crunch, so you will always feel that little burn. Okay, so that is acute soreness. That is not delayed. And the phenomenon why you get that burn is because the lactic acid starts producing in that region, and that gives the burny sensation at that area. But in delayed onset of muscle soreness, it's not going to be because of lactic acid, not going to be because of the burn. So it's going to be after a few days, but it's not because of the lactic acid formation. So I'm going to give you a more detail on what happens later. Okay, so now spasm or DOMS. Now we all get a lot of confused with the like whenever we're a bit confused between these two terms because they happen during an activity. So I'll just give you a little bit idea about it. This is a cartoon representation just saying that the muscle, the brain is saying, oh my god, you're really doing a lot of activity doing work. So muscle is like, yes, because I'm in agony, because I am broken, I am in pain because of the uh, because of the activity which I had earlier. Okay, so now coming between the difference, that's what I told you about the difference between muscle cramps or spasm and DOMS. Now, this is a very, very, very wide difference when it comes to muscle spasm and DOMS. Muscle spasm takes place because of contraction. Okay, this is isometric contraction, and DOMS takes because of eccentric contraction. So this is one of the major things. Now, whenever you have a contraction taking place, what would you do to relieve it? You would like to lengthen it, right? So pain is relieved by stretching. Okay, so whenever you relieve it, it's stretching which will make it better. But when you come to domes, okay, you have eccentric contraction happening over there, and if you stretch over there, you think that the muscle fibers and everything, the whatever structure which is already torn, would be more pulled apart, right? So that would be causing more exacerbation. It can cause a lot of damage further on. Okay, then coming to the pain aspect of it. In the pain, they say that the pain and spasm is due to uncontrolled muscle spasm. Like the contraction is so bad that the pain occurs because of that contraction. But whereas when in domes, it's more of an inflammatory. Okay, that is not because of uh, cross which is taking place between the microstructure of the muscle, but it's because of inflammation process which started off in the muscle. Okay, there'll be increase in cross bridging between the muscle fibers, as I said, and in domes, it is more of a strain. Okay, it's going to be more of a tear. It's more going to be the first grade of strain, which is few muscle fibers have been torn. Okay, so now coming on to the location of the soreness. So now we say that the location is usually the muscle tendinous junction, the area where the muscle goes and connects the bone. So that is the region where usually the soreness takes place. Okay, so you can see that picture, which is a pink, the pink color picture, that is hematoma stain. I mean not hematoma, hematoxin stain. There are collagen fibers which are a little bit wavy in this region. So usually when a tendon is attaching to a bone, it's not supposed to be a wavy, like muscle tendon junction wouldn't be a little wavy, but when you have this soreness, this is gonna get disrupted and it's gonna show like wavy or very like not an organized pattern. Okay, now different factors that causes delayed onset of muscle soreness. Yeah, so basically minute test. Okay, so minute test to the muscle tissue and contractile components. Okay, so whenever these tests have been occurred, there's going to be release of creatinine kinase. Okay, so what is creatinine kinase? Creatinine kinase is nothing but an enzyme which will come, then there is some sort of damage to the muscle. Okay, so there will be release of the creatinine kinase, myoglobin, your muscle is damaged. So there's going to be muscle protein which will be coming out from the muscle. And troponin. Troponin are the proteins which are being present in the cross bridges. So those are also going to come out in the process. Okay, now all these proteins are coming out. Obviously, it's going to be such a lot of osmotic change. There'll be an osmotic imbalance that will take place. So that will cause fluid retention. There'll be muscle spasm. Okay, so because of this pain which is occurring, your muscle will then go for spasm. Okay, overstretching and perhaps tearing of the muscle connective tissue harness. Acute inflammation. There is a theory which is said that acute inflammation is a precursor to DOMS, and alteration in the cell mechanism for alteration cell mechanism for calcium regulation. It's said that the calcium regulate the deposits of calcium starts getting, because the inflammatory process starts. There's a lot of calcium accumulation in the disrupted region, and there is going to be a lot of imbalance which is taking place in that region of the calcium accumulation, and that can actually lead, and it can cause a damage to the muscular tendon junction, and a combination of all these factors can actually cause the tear. It can promote uh, the DOMS, can promote DOMS. Okay, so now different theories that are associated with delayed onset of muscle soreness. Okay, so the different the theories. Now, first coming to the inflammatory theory. Okay, so the inflammatory theory is trying to say that there will be like in this, they're trying to actually explain the part of pain, like how you can actually get pain. Okay, so as the inflammatory process sets in, you're going to get pain, and that is one of the cardinal sign of DOM. So basically, what happens is the muscle fibers initiate degradation of the micro and macromolecular structure of the um, cell, and this gives a response to an autocoid leukotriene synthesis. Okay, PGE2 is nothing but prostaglandin enzyme. So basically, what happens is that this enzyme, it goes and when it attaches to a G protein. Okay, it's another molecule which is just circulating around the blood. So when it attaches to the G protein, it's going to activate some receptors on the G protein. So there are some EP1 to EP4 receptors on the G protein. So any of these receptors are activated, it's going to start a chemical reaction, and that's going to start pain. And that's the reason that causes pain. So that is basically the inflammatory theory um, DOMS. Okay, so this kind of inflammation actually starts peaking out in the 48 hours after the exercise which is taking place. Next, coming to the hydroxedema or swelling theory. So as I before had told you that when the inflammation kicks in, there's going to be osmotic change, and there's going to be fluid accumulation which takes place, and also there's going to be increase in porosity of the blood vessels. So this will cause increase of the fluid within the blood cells, and this you can actually recognize by 24, 48, and 72 hours post an action. So you will feel like your limb is getting heavy, and you will be like, you will understand the difference about it. Okay, so next, stiffness and decreased range of motion theory. So if you have a stiffness, if you're not able to move according to a particular joint, so any bit of eccentric loading, it can cause a lot of damage because your muscle is already first of all tight, and it also hampers your shock. Like if any force or any kind of shock is being given, that is going to be hampered, and it's not being taken properly by your muscle. Okay, so okay, decrease in muscular strength theory. Your muscle is not able to take up the strength, it cannot take up the load. So again, it can easily cause breakdown in muscle fibers because it's not strong enough to um, to sustain the load. Okay. Now coming to the sequence in DOMS. So first of all, we have an unaccustomed exercise, which is in an eccentric fashion. High muscle forces that damage the like because of these forces, the sarcolemma is going to get damaged, and there's going to be enzymes which are going to be released. There will be damage to the contractile and the non-contractile structure. Metabolic accumulation. Here I'm going to stress out very much that it's not going to be lactic acid. It's going to be more of all the enzymes. It's going to be all of the other things which are going to come in the play, but it's not going to be lactic acid at all because lactic acid is only in acute phase. It's not going to be in your delayed phase. Then soreness leading to pain and inflammation. As the inflammatory theory says, there's going to be a lot of pain receptors which is going to be activated and that's going to be set. And slowly will start the healing. So this is the action sequence what takes place in those. Okay, so this is just a small picture representation which says that after you give an eccentric exercise, you're gonna have the inflammatory changes which are gonna happen, and there's also gonna be calcium accumulation, which I also mentioned previously. When the calcium metabolism is gonna be hampered in these cases. Okay, now what about what markers do you see in these patients? And these healthy individuals, they're not going to be patients because obviously they're going to be people who are running out of field. You cannot call them patients. But yeah, so what do you see in these individuals? Okay, you will see enzyme lactic dehydrogenase. Why do you see this? Because lactic acid, which is formed in acute phase, the enzyme will come into action and it will try to convert it into pyruvate acid for the energy production. Okay, so you're going to see this enzyme which will be released. There'll be other aspartate is nothing but an amino acid, transaminase, which is an enzyme which is required for all chemical process which takes place uh, during the molecule shift. I mean, it's more into biochemistry, and the definite marker will be your creatine kinase. Next, coming to effect of domes on muscle strength. Okay, so now obviously your muscle fibers are going to be damaged. So if that's going to be damaged, do you think you're going to generate more force capacity? No, the force capacity is going to be reduced. Okay, so there'll be reduction of that. There'll be physical because why? What is the reason of it? Because there could be disruption, as I told you, disruption of the muscle. There'll be failure of the excitation contraction coupling, and because of the loss of contractile protein. Okay, now factors for reducing delayed onset of muscle soreness. What do you actually take to reduce it? So when you have to start off any training, you always should start off very lowly and go increase it gradually. You shouldn't go on a cycle. Okay, fine, I want to lose weight. Okay, fine, I want to become a strong athlete today. So I'm gonna go in full weight. No, you need to go in a very gradual process. Okay, minimize eccentric work. You need to go obviously first you start off concentric isometric concentric and then when you gradually start off in eccentric training. Okay, start off high intensity exhaustive training. Okay, so basically high intensity exhaustive training is nothing but you take high bar and then you take a minimum like a low training for some time, then you go again for a high bout of exercise, high intensity bout of exercise, and then again you go for a low intensity. So you just keep on altering. You're not giving, you know, you're not going that immediately, but you're taking it slowly and then again coming down, again going slowly, again coming down. So that okay. Lines of management for delayed onset of muscle soreness. Um, so usually medicine. So medical management should have painkillers, anti-inflammatory. There is a recent study which has come up saying like I think BMC article has spoken about that there is a kind of Eastern medicine which is trying to incorporate their medicines into it, but as of now that's just a protocol and nothing else has been proven. It is just a very recent article in 2020 itself. So yeah, that's one thing. Nutrition supplements. Okay, now in nutrition supplements, it's very important that you should be very well hydrated. Post exercise, you need to be consuming some amount of protein, and yeah, and your levels of glucose levels should be kept in check in this. Physiotherapy wise, yes. So there are few things which I would like to speak in physiotherapy wise. In physiotherapy, like recently I had studied, it was a 2016 article which said that usually compression, like okay, you think it's going to be swollen, it's going to be heavy, so let's try compression. So they said that compression therapy doesn't work, and it is better like there's no point of giving compression therapy. But whereas if you see anything which is proven, it's more of hydrotherapy. It's more of a contrast bath, like hot and cold contrast bath, which will improve the blood circulation in that region. And strengthening. Okay, like you have to start off strengthening of your muscle because obviously you're going to start off weakening also. Gradual strengthening is like the main key, and stretching can be started, but in a very low pace, not really fast. You cannot just jump on and give. So these are like the things that you can usually give. Apart from that, if you see like for the pain, people give up modalities like TENS, ultrasound, um, any of the modalities that reduce pain. So laser has been one of them, which has been really good and which has been proven. So in physiotherapy management, you can start off with any of those. Okay, so now just brushing through some of the studies and the advances. Yeah, so first is foam rolling for delayed onset of muscle soreness and recovery of dynamic performance. It's a controlled laboratory study. Okay, so they had taken like around 22 years around individual, and they had induced soreness in these people, and they seen like whether foam rolling would actually work. Um, they have seen that all of this. They had also said that massage is also not very much um, uh, help that doesn't help very much in the relieving the domes. Um, what do you say? Yeah, so whatever the effects of domes, it doesn't give so much of this. But there's something called as warm water skate massage. So that is really very good for relieving the symptoms. But foam rolling is also another one thing which is come out to be really very, very good and very much effective. They say that foam rolling after, like immediately after the eccentric loading of your muscle can cause a lot of change because it's going to be causing out like immediate washout of your whatever metabolites which takes place, and it also causes like stimulation of all your muscle fibers. Like there's going to be your muscle spindle fibers. So when you give a foam roller at that moment, it's going to cause a contraction which is minimize a lot of damage because of the muscle spindle reflex. Okay, then coming to microcurrent on delayed onset muscle soreness. Now, this is a very old article actually. It's really very old. It's 1999. But I just wanted to emphasize that how microcurrent is actually like what people think about microcurrent basically. It's not, they said that it's not at all useful because the current amount is very small, and microcurrent actually goes on the theory that a current of lesser micro amplitude. So it's given a new amplitude, the currents which are given. That this study said that they had given like around 200 microamperes for 10 minutes, and again they had given like 100 microamperes for another 10 minutes for from after 24 hours, after 48 hours, and after 72 hours, and they didn't find any much difference. So they didn't. They came to a decision that microcurrent isn't very much in charge. So let this all things don't like confuse you when they come around. And the best thing that has come up is vibration therapy. Now, vibration therapy, we have spoken a lot of things. If you see nowadays, like on the sports field, they'll be using something called as um, hypervolt. So hypervolt works on vibration therapy. There's going to be vibration. So basically, as I told you that like in the previous physiology, that if your muscle spindle has been activated, it's going to cause less amount of stress while eccentric training. So in vibration therapy, that's going to be the thing. There'll be less amount of stress that is happening, and because your reflex system is being activated, and so it will cause a reduction in muscle soreness. So this was a literature review which is done. So they had actually used vibration therapy. They had been using whole body vibration. There's nothing but WBV, and they found that a lot of reduction in pain. They had checked for pain thresholds, pain pressure thresholds. They have checked for people's activity, like sprinting activity, how are they able to run. So these are some parameters that they checked, and they checked even for the VAS of the person. Okay, now coming up to the last and the final article which I want to discuss, it's nothing but warm up reduces delayed onset of muscle soreness, but cool down does not. So we always think, okay, fine, we are doing warm up and cool down. So why these both things are important while doing an exercise? Warm up is so much important because warm up will actually increase, like the article says so, that when you start off doing warm up, it's just the words of warm up. You're going to start off increasing the heat in the muscle. It's going to be increased elasticity. And so when you do an exercise in this increased elastic state of the muscle, you can stretch out. It's very like having an injury is so minimum because you have you've expanded your muscle fibers. So it's easier for you to move it. So injury will be a bit less of, but cool down does not. So basically what happens in cool down, you you've already done your exercise. For example, you have done an exercise which is higher intensity, eccentric training exercise you have done. But when you do a cool down, when you have already done an eccentric training, don't you think the cool down will aggravate it? There's a highly possible chance, right? So the cool down will aggravate, or it might not, it won't even aid, it won't reduce it. Forget about activating, it won't reduce the already disrupted muscle fiber. So that will actually cause a lot of problems. Like it wouldn't, even if it doesn't cause problem, it won't even have any effect for the muscle fiber. So it doesn't have any kind of effect. So that's what they said. And they had made a study. And again, as I told you, that pain pressure threshold and VAS was taken into consideration in the study. And they found out that warm up was actually really good. Warm up with cool down was also beneficial. Cool down actually helps in a lot of lactic acid removal, which takes place because of the acute soreness. Sorry, not acute dome, acute soreness. So it helps in washing out the lactic acid. But that's why the two together reduced quite a lot. But warm up was much more better. I mean, warm up showed reduced in symptoms. Cool down wasn't so much. So yeah. So this was what I wanted to present you. Yeah, so thank you. And I hope you have learned something from whatever I present. So any questions?
Yes, Awina, this was actually morning. We have a lecture on energy systems in the human body.
Yeah.
After that, listening to domes is like really worth, because that's where the ATP was discussed and the lactation, lactate thing was discussed.
Yeah,
So following that, lactic acid. The following that, we listening to domes is also nice actually. So thank you for your wonderful presentation, and thanks for taking the time. And I thank the principal, vice principal, and your professors of Father Muller's Medical College for making you to present in our ExRxIndia's Father Students by the Students web series. And I thank all the participants present now. Would you like to take any questions?
Yeah, sure. Anyone can pull in anything.
Participants, if there is any doubt, you can raise a question. Duna madam?